So our project was born to partner with primarily fire departments in the area to reduce ER visits and hospital readmissions for clients in the community. And we were focusing on doing this with a partner with the fire departments, but then also working with our Meals on Wheels program and registered dietitian to work one-on-one with clients to nutrition them in their diabetes or other chronic illnesses. The why is to really help people, primarily seniors, age in their homes as they want to safely and independently with nutrition services and other community support. And then part of that would be, again, to reduce ER visits and hospital readmissions, and then overall would be to reducing healthcare costs for the state, local municipalities, and the individual consumer.
The We Care project was enacted in 2020 to help seniors in Delaware 55 and above, to help keep them safe and healthy at home, and to help them manage their medical conditions. When COVID hit, we realized that a lot of seniors couldn't go to their doctors, so a lot of them were home. Some they can't reach their family, they don't have anybody to talk to. And so when We Care came to assistance, we were able to reach out to them. We were able to bridge the connection between them and their physicians so they can continue to receive the health care that they need. And we make We Care available 24/7 for them to call, just in case if they need any kind of clinical support. So we were able to fill that gap.
I work for the Department for Aging and Independent Living in Kentucky, and we took advantage of this funding opportunity to examine disaster plans that are available or to our senior centers and what kind of plans they have in place so that we can make sure that our seniors and our service population receive services when there is a disaster. It's really to make sure that seniors are able to continue getting services, information, meals when there is a disaster and maybe the center is closed or the meal route is not available to go out for delivery that day.
Our project is called Virtual Smart Living. It is a initiative that comprises of 5 different components, which is individual counseling, nutrition group, live cooking demonstrations, a technology group that teaches seniors how to use MyPlate to achieve healthy eating, and a mental health component called Do More, Feel Better. Although we didn't know that the pandemic was coming, it was sort of all the services are delivered virtually, so it sort of fits in right well when we started all the services during the pandemic. The rationale behind the project is that we firmly believe that we should service clients in a holistic approach, meaning that if someone is not eating properly, someone is not changing their eating habits, it's because that there could be an underlying mental health component to it, and we are trying to address it by providing both nutrition services and mental health services at the same time.
We are developing culturally inclusive meal box delivery for older adults. We have gathered food preferences data by surveying the community for food preferences to figure out what folks actually want to eat. And we use that data to design menus and recipes. These menus are then approved by our dietitian as having met federal guidelines for daily nutrition. And then when the program is fully operational, participants will be receiving weekly deliveries of fresh, frozen, and shelf-stable food to prepare 21 meals a week. There are so few programs that exist that are providing total nutrition to older adults. And even further, there's even less programs that are offering culturally inclusive meals with the option for medically tailored meals. And so we are aiming to fill these gaps.
Meals on Wheels at Interfaith Ministries for Greater Houston explored ways to use a virtual assistant device using the Amazon Echo Show to see how it can support the social determinants of health, along with its Meals Plus delivery services to reduce isolation and support their clients' independence for aging in place. We wanted to improve the lives of seniors by leveraging artificial intelligence technology.
So the Texas Congregate Meal Initiative is a research to practice translational project which is trying to modernize the congregate meal services in the state by improving the well-being, social connection, opportunities for the elderly, for the older Texans. From 2005 to 2019, the number of meals served for the older Texans by the congregate meal programs decreased about 66%. But the number of older American Texans increased 2.5 million during this time. It presented a compelling problem for the decision makers and the policymakers. We needed to find a solution through innovations thinking.
Be With stands for Belongingness and Empathy with Intentional Targeted Helping, and it's a short-term warm calling program. It's this innovation that we created to connect home-delivered meal volunteers and providers who are affiliated with aging services that provide nutrition services to older adults who receive home-delivered meals who may be experiencing heightened isolation, loneliness, and even elevated mental health distress, including suicide risk. And so we developed an 8-week warm calling program that's really designed to just provide a small dose of sincere connection. And we train the volunteers who provide these phone calls in some evidence-based training that's really designed to accomplish that, to have warm conversations, to know how to connect, and also to know how to respond to mental health distress. Well, the why is that older adults are at risk of suicide. Suicide is a problem that happens across the lifespan, and a lot of people don't know that older adults have one of the highest rates of suicide. In fact, recent statistics say as many as an older adult dies every 65 minutes in the United States. And so things like loneliness and social isolation, we know from existing suicide research, are contributing factors. And we also know loneliness is dangerous and loneliness is lethal. And so really wanting to understand and identify that older adults are at risk of suicide is the why behind this, and how unique nutrition services is as a method to combating suicide among older adults.